And I would like to invite the first session, Dr. M.D. Kaur ma'am. Ma'am is Professor in Heavy Management, Ethics and Anesthesia, Research and Medical Education. We welcome you, ma'am. I hand over the proceedings of the session to ma'am.
The first speaker is, I welcome you all to this APPEC2023 and without any further delays, I would introduce the speaker. She is Dr. Anjali Kochar and she is Associate Professor at VMMC and Safdarjung Hospital, Delhi. Her areas of interest are simulation in anesthesia, airway management, teaching, training and innovations in anesthesia. Dr. Anjali Kochar is a very capable teacher. I invite you to give your talk.
Thank you, ma'am, so much for having me here. Thank you so much. Good morning, everyone. I'm Dr. Anjali Kochar, and I'll be talking about ASA Physical Status Classification. In this lecture, we will learn about the introduction of the ASA Physical Status Classification, its historical background. We will discuss all the categories in detail, including examples, and we will see how we can apply this classification to our obstetric and pediatric patients. Along the way, we will solve some clinical examples. Introduced by the American Society of Anesthesiologists to take patients at the time of pre-anesthetic evaluation, ASA physical status is given to the patients based on their medical history and comorbid conditions. It is used by anesthesiologists worldwide as a tool to assess patient physical fitness before surgery. Although it is not designed to be a risk predictor, ASFES is associated with post-operative morbidity and mortality. It gives overall health of the status of the patient undergoing surgery. Historical background. A committee was constituted by ASA Society in 1940s to devise a system for collection and tabulation of statistical data in anesthesia, which led to introduction of ASA classification. Initially, they had given 6 classes of physical state in the 1941. Class 1, 2, 3, and 4 are same as we are using today. Class 5 and 6 were given to the emergency cases, which were otherwise belonging to 1 to 2 stage of the ASA classification. It was modified in 1960s, where the emergency grades 5 and 6 were removed, and only a letter E was added to the ASA status of the patient if the patient was undergoing emergency surgery. And a class 5 was given to the patient who is a moribund patient not expected to survive 24 hours with or without operation, which was subsequently modified to a moribund patient who is not expected to survive without the operation. The timeline of 24 hours was removed, and this fact that the surgery is the only chance for that patient to survive was taken into consideration. In 1983, class 6 was added, which suggests brainstem dead patient which is being operated for organ donation. Further revisions were done in 2014, where adult case examples were added, as we will be discussing the ASA classification, which is being given in 2014. And last amendment of the classification was done in 2020, where pediatric and obstetric examples were added. Now coming to the classification. The ASA grade 1 patient, by definition, is a normal healthy patient. Patient who is healthy, who is non-smoker, with no or minimal alcohol use. ASA category 2 patient is the patient with mild systemic disease. This patient has mild disease only without substantial functional limitation. Patient may be a current smoker, social drinker. Patient may be obese, but BMI of between 30 to 40, and well-controlled comorbid illness like diabetes or hypertension, which needs to be under control. Patient might have mild lung disease. All these category patients are categorized as ASA grade 2 patients. That means they have mild systemic disease which is under control using medications. It has to be noted that having multiple comorbidities does not upgrade the status of the patient. If the patient has diabetes as well as hypertension, but both are controlled, then the patient will be categorized as ASA 2 patient. An ASA category 3 patient will be a patient with severe systematic disease. That patient will have substantial functional limitations. Patient may have one or more moderate to severe diseases that are poorly controlled. For example, patient is having diabetes with high HbA1c, high blood sugars, hypertension, with taking medications but blood pressure is not under control. Patient may be a COPD, patient may be morbid obese. Any patient with heart disease, patient with history of MI, which is more than 3 months old, cerebrovascular accident, transient ischemic attack, coronary artery disease, or stent patients. They are all ASA category 3 patients. This category also includes end-stage renal disease patients who are on regular dialysis, patients who are alcohol dependent, and patients who have implanted pacemaker are also included in this category. An ASA grade 4 patient is a patient with severe systemic disease that is a constant threat to life. So vis-a-vis ASA category 3 patient, where the patient is having severe disease which is not under control, here the disease is constant threat to life. Patient is in constant danger because of the additional comorbid condition that the patient is having, and in addition patient has to undergo surgery either because of the medical condition or because of the unrelated condition. This category includes patients who are having ongoing ischemia, who have severe valvular heart disease, who have recent MI or recent stenting done, or patients who are in shock or septicemia, ARDS, or end-stage renal disease patients who are not on dialysis. As we can understand, if the patient is having end-stage renal disease and is not undergoing dialysis, patient is under constant threat to life because of metabolic acidosis or hyperkalemia or other associated problems associated with the renal disease. And at that point, if patient has to undergo some surgery, some kind of surgery, patient will be categorized as ASA category 4 patient. ASA 5 patient is a moribund patient who is not expected to survive without the operation. This is a patient which you have to take up the patient. There is no scope of optimization. Patient needs to be taken up. Surgery is the only chance of survival. Resuscitation and the surgical procedure will go hand in hand, and this patient will be, after the surgery, they are kept in intensive care unit for the post-operative better care. Examples include patients who have ruptured aneurysms, either abdominal or thoracic. So this patient is going to die if surgery is the only chance for this patient to come out of his condition. Patient otherwise may be a young, healthy patient, but now has undergone massive trauma, including injury to the chest, abdomen, long bone fractures. Now this patient is not treated, if not taken to OR, is under threat to life. This kind of patient will be labeled as ASA grade 4 patient, a peribond patient who is not expected to survive without the surgery. Other examples include patient with ischemic bowel. When the patient is having ischemic bowel and associated cardiac pathology, or because of the septicemia, patient ended up in multi-organ dysfunction, that patient, we have to take out the gangrenous bowel to give the patient a chance to survive. So that patient will also come under category 5 patient. ASA 6 category, as we know, is a brain dead patient who is to be operated for organ donation. Any category of the patient who is undergoing emergency surgery, a letter E is added to the ASA class of the patient. Now, how ASA defines an emergency surgery? An emergency is defined as existing when delaying treatment of the patient will lead to significant increase in threat to life or body part of the patient. Now let's see some examples. So this is the case, 58-year-old female. She is posted for hysterectomy due to fibroid uterus. Patient weight 65 kg. Height is 5 feet 5 inches. She engages in physical activities like walking and yoga on daily basis. Patient is known hypertensive since 5 years and she is on tab amlodipine 1 milligram for the same. Recently, she was diagnosed to have diabetes and she was started on tab metformin. She has an HbA1c of 5.5%. Her blood sugar on the day of surgery is 100 milligram per deciliter. Her heart rate is 78 per minute and blood pressure is 138 by 85 mmHg. So, what is her ASA physical status? So, what all things we need to consider when we want to assign the ASA physical status? Age doesn't count in the any of the ASA thing that we need to see for the categorization. BMI, yes, BMI is important because any patient with high BMI will be categorized into higher category. So for this patient, if height 5'5" and weight of 65 kg, she has a BMI of less than 30. She is physically active, although this doesn't directly come into the calculation. But yes, we have to take into account her comorbid conditions. She is hypertensive, on amlodipine, and her blood pressure is 130 by 85, which seems to be well in control. So she is a controlled hypertensive. She has another comorbid illness, diabetes, her on treatment with HbA1c of 5.5 and blood sugar of 100 milligram per deciliter, which also is well controlled. So all the conditions we take into account, her BMI, her comorbid illness, which are well under control, we label this patient as ASA2. Another example, 65-year-old man, posted for laparoscopic inguinal hernia repair. He is 5 feet 10 inches tall, weighs 80 kg. He is physically active, goes for cycling every weekend. He is hypertensive with past history of myocardial infarction, which happened 3 years ago, and stenting was done at that time. He is currently on aspirin and metoprolol. His heart rate is 62 per minute, and blood pressure is 124 by 80. What is his ASA physical status? Again, we take into account his BMI, which seems to be normal. He is hypertensive, on medication with blood pressure of 124 by 80, which is well under control. But past history of MI puts him at a higher risk than any other ASA2 patients, and he will be categorized as a ASA3 patient because of history of myocardial infarction and stenting in the past. Another example, an 82-year-old man posted for cataract surgery. He has no significant past history. He has not undergone any surgery. He is able to do his daily activities, stays on first floor of a building. He is able to climb up and down and goes for walk every day. What is his ASA physical status? So this patient, although elderly, has otherwise healthy and no comorbid conditions. So we will label this patient as ASA category 1. Now coming to obstetric examples, the physical state remains the same, the category remains the same, but in obstetrics, there is no ASA category 1 because the prenormal pregnancy also has certain physiological changes that puts the patient at higher risk than the otherwise normal healthy patient. So ASA physical classification is obstetric starts with ASA category 2, which is normal pregnancy. Also, well-controlled diseases of the pregnancies like gestational hypertension, diet-controlled gestational diabetes mellitus, and preeclampsia without severe features are categorized as ASA category 2. Patients who are having severe diseases along with pregnancy, like preeclampsia with severe feature, gestational diabetes mellitus with insulin requirement, or patient on anticoagulants are categorized as ASA category 3 patients. Any patients who has complications like HELLP syndrome, eclampsia, peripartum cardiomyopathy, or is having a heart disease which is uncorrected or decompensated, will be categorized as ASA category 4 patient in obstetrics because such a condition is a constant threat to life. ASA category 5 for an obstetric patient, a moribund patient who is not expected to survive the operation will be, example will be uterine rupture, where we have to break up the patient, otherwise the patient is unlikely to survive. He is put after the ASA class. Now let's see one example. A 21-year-old female is brought to emergency OT with acute appendicitis. Patient is 20 weeks pregnant. She is undergoing regular antenatal checkups. There is no other significant past history. What is her ASA physical status? Now this 21-year female who is otherwise healthy, but she is having 20 weeks pregnancy, which categorize her into ASA 2 category, and we will put an E. So because she is undergoing emergency surgery, she is ASA 2E category. Coming to pediatric cases, pediatric examples that have been listed in ASA physical classification system, these which have been added in year 2020. A healthy pediatric patient, healthy child with normal BMI is ASA category 1. ASA category 2 child examples include a child with epilepsy, which is well controlled, child who is asymptomatic but may have a congenital heart disease without any symptoms. So many a times you must have seen in the pre-anesthetic clinic that you get a child is asymptomatic, mother is giving no history of any respiratory distress or other symptoms, and on the examination you find a soft murmur, systolic murmur, and that child is labeled as ASA category 2 because he is asymptomatic but still has a congenital heart disease, which is mild in it, which is probably at this stage mild and asymptomatic. Other examples include autism with mild limitations, non-insulin dependent diabetes mellitus, and abnormal BMI for the age. ASA category 3 children will be, now ASA has categorized all infants, neonates into ASA category 3 because of the challenges that we face in anesthetizing them. Also, pediatric difficult airway has been labeled as ASA category 3, although there is no category assigned to difficult airway in case of adult patients. Other categories of ASA 3 in children remain similar to what we have in adults. Children will have who have poorly controlled epilepsy are ASA category 3, severe OSA, uncontrolled diabetes mellitus, or autism with severe limitations are categorized as ASA 3 patients. Examples of pediatric examples of ASA category 4 patients are patients who are in septicemia, shock, who have symptomatic congenital cardiac abnormality, having patients having heart trauma or severe respiratory distress are categorized as ASA category 4 patients. ASA category 5 patient, our child is one who has suffered massive trauma similar to as in adults, child with intracranial hemorrhage, or patients who are ECMO or are respiratory failure are categorized as ASA category 5 pediatric patients. Now let's see one example of the pediatric case. A 4-year-old healthy male child has come to PSA clinic. He is to be posted for hernia repair. What is his ASA physical status? So healthy child coming for inguinal hernia surgery with no complaints. So we label this child as ASA category 1. However, the ASA category might change on the day of surgery if the child develops some symptoms. For example, the same child comes to OT 1 month later for the same surgery. So he has been given the date and is now reported for the surgery. But at this time, the child is having running nose or cough. There is no fever, chest is clear. Now, will his ASA physical status category be the same or will there be any upgradation? So, although URA has not been given in the ASA pediatric examples, but many institutions have made their own protocols to categorize such patients, and many of the institutes will increase the ASA category of such patients who are having URI, because as we know, with URI, the child may have some complications during the anesthesia course, which are otherwise not expected in a healthy child. So this child will be labeled as ASA category 2 patient. So what are the uses of ASA physical status classification? It is used as a communication tool among anesthesiologists and also other clinicians to understand the physical risk or the comorbid conditions that the patient is carrying. It helps in appropriate resource allocation and any additional testing if it's required or not. For example, choosing wisely initiative of the ASA, it suggests that we should not go for any laboratory testing if we find that the patient is ASA status 1 or 2 and is undergoing low-risk surgery. So it really helps in saving of the resources, as well as doesn't allow patients to undergo unnecessary investigations. However, if you find that this ASA category 1 patient has to undergo surgery which has its own risk involved, then you may advise investigations. So ASA physical status labeling, it gives the clinician an opportunity to decide whether the patient has to undergo further testing or patient can be, if the ASA patient can be cleared without additional testing. Also, we use ASA physical status classification in all clinical investigations to compare data. There is hardly any investigation or research in anesthesia which does not document the ASA status of the patient that they are being studied. ASA physical status also gives a comparison of the hospital's performance vis-a-vis ASA 3 patients. What is the outcome in one hospital vis-a-vis other hospital? And some of the insurance companies are also using it for billing purpose, just adding on some additional amount if the patient belongs to higher ASA category. ASA physical status classification is also part of risk assessment scores, although as earlier said, it is not designed to assess risk of the morbidity or mortality of the patient following surgery. However, it is being used to some extent and as part of other risk assessment scores. ASA physical status per se has very low positive predictive value when it comes to prediction of the mortality attributed to anesthesia. However, as you can see in this table, the higher ASA categories are associated with higher rate of complication as well as a death rate as compared to ASA category 1 patients. ASA physical status classification is also part of American College of Surgeons National Surgical Quality Improvement Program, which has 20 variables in total, and ASA-PS is one of the variables which predicts the outcome of the patient following surgery. Despite so many advantages, despite being simple to use, despite its worldwide uses, it has certain limitations, being subjective in nature with high inter-observer variability. Many of the clinicians will label the patient differently, and studies have shown that the variation is more common in ASA category 2 and 3 patients. It's very clear that this patient is ASA 1 or that this patient is a moribund patient and may not survive. But in between categories, particularly category 2 and category 3, there is high inter-observer variations, and this leads to if the patient is overestimated, if the patient is getting an ASA 3 and is advised additional tests, and sometimes even cancellation of the surgery, that is something that we need to look into. Though some objectivity has been added by addition of examples and some variation has reduced. Once the example has been added by ASA 1, still it continues to be having high inter-observer variability. Other important limitation of ASA physical status is it does not include type of surgery the patient is undergoing. The patient is classified as ASA 1, but if the surgery is high risk, the outcome may not be the same. So to summarize, ASA physical station classification is a simple tool to categorize patients depending on their preoperative health status. It is widely used to communicate among anesthesiologists, including case assignments and also for research purposes. It is not a risk assessment tool. There are other scoring systems which are designed to assess the risk of the patient undergoing anesthesia and surgery. And ASA system has its limitations, being subjective in nature and has high inter-observer variability. These are my references, and thank you so much for the patient listening.